how can you not teach the Affordable Care Act now that we know that it's constitutional law? So quite frankly, a couple years ago, the chair of our department asked us all together and revise our syllabi and revise our talking points as to the notion that this big piece of legislation was coming and had been passed, and sure enough, here we are and it's constitutional, and we will keep doing just that thing. So the students have to understand, in my perspective, where we are now, because most of the law isn't going to go live until 2014, what the law is going to do to change where we are now, and then what are the outcomes going to be because of that law to hopefully give us better quality and cost outcomes than we have right now in our unsustainable healthcare system. So the law is, of course, practical in the sense that the students are going to want to know how it affects them personally and their healthcare and how do they get their coverage. But in terms of a teaching moment, it's critical to show and use as a transformative element of how the healthcare system has come along to where it was to now where it's going in the light of pretty solid constitutionality.
So the students are clearly aware of the decision. I got several emails yesterday from former students, one of which was really wonderful. It was a recent undergraduate student, in fact, who's working at HHS right now, and she emailed and said, "Thank you so much for your course. I know that I am able to read this decision and parse it more quickly than those people who I'm working with, and it's really made it easy for me to be a part of the discussion going on over here," and so that was really exciting for her. I got other emails from students saying, "Can you believe the decision? We were talking about how it broke down." So clearly they are following it. They're aware of the enormity of the decision upholding the ACA. Going forward, it's going to be a key part of health services and law course. As Professor Burke mentioned, also the public health law course. There are a lot of provisions in the ACA unrelated to insurance reforms, related to access and quality and public health and data collection and other things that are going to crop up in courses across our curriculum. So there's no question that the ACA and this decision are going to be playing huge parts in our curriculum going forward.